Good afternoon. I'm George Latimer, Westchester County Executive, and I'm here today with senior representatives of various departments of county government to launch a program that we think is going to be very important in saving lives. We have the opportunity to hear from Dr. Charlita Amler, who's our Commissioner of Health for Westchester County Government. We're also going to hear from our Deputy Commissioner, Joe Glazer, from our Community Mental Health Department. Also from David Toledo, who's Director of Operations of our Department of Social Services. We're joined by another one of our senior managers, Reverend Troy DeCohen, also of the Department of Social Services, and Legion Thomas, who is our host today here at Volunteers of America for Greater New York. We're located on the Valhalla campus, and we're launching a program today of our Naloxone Box program. That's a program that was designed as one more tool to help us fight opioid-based overdoses here in Westchester County. We're joining you from a location where we have one of the Naloxone boxes up. It's one of many of our county housing shelters. And this kicks off the program, which is a partnership between these departments, the Health Department, the Department of Social Services, and our county community mental health department. The device has 3 of them installed in this building. It's a metal housing unit that is mounted to the wall, and it contains 2 doses of Narcan nasal spray. Naloxone, or Narcan, is the medication that is used to reverse an overdose by opioids. It's given whenever a person is showing signs of an opioid overdose. Narcan blocks the toxic effect of the overdose and restores breathing to the individual. It's quick and easy access to life-saving Narcan, and by placing it here in this facility and other similar facilities, it puts the life-saving medicine immediately at the fingertips to save a life, to save a person's life from them dying to an overdose of opioids. We hope that this public access increase for Narcan is going to help us see fewer deaths to opioid overdoses here in Westchester County. So I'm going to ask Dr. Charlita Amler to walk us through what the situation is like with our test dummy, so she can give you an idea of what happens in those critical few minutes when a life is at hand from an overdose. We're also joined, by the way, by Westchester County Legislator James Nolan from Yonkers, who's with us here today, and the members of the Board of Legislators are with us in sponsoring this program. So, Dr. Amler, if you would, please.
So thank you, County Executive, and I want to thank the VOA for hosting us today. And as you heard, this is our latest tool in our fight against opioid deaths. The Naloxone box does provide easy public access to Narcan, or naloxone, which, as you heard, is really kind of like an antidote for opioid overdoses. And what it does is it really attacks and blocks the receptor sites for opioids in the brain and allows the person to be able to breathe again. One of the nicest things about this drug is it's extremely safe. When I was a young pediatrician, I used to give this drug to babies. It is a very safe drug and very, very effective. And it has saved many lives. We have been, for many years now, we've been training police officers to administer Narcan when they arrive at the scene of an opioid overdose. And they've literally saved thousands of lives using this drug. It really does need to be a drug that is within reach, because when someone is overdosing, you literally have seconds, only a matter of 1 or 2 minutes to get their brain back functioning, to get them breathing again before the effects become, unfortunately, non-reversible and the person is dead. So the advantage to this drug, it's really like a miracle. You can have somebody who's overdosed from an opioid. They may not be breathing at all. Their heart may not be beating. Clinically, they are dead. You give this drug, and if it's an opioid overdose, within minutes, they can be sitting up talking to you, wondering what happened, and it's as if nothing happened to them at all. So it's really very much a life-saving drug. It really is a drug, though, that every second does count. And so it's very important that we have it close at hand so that we can get to it and administer the drugs quickly. All it takes is about 2 puffs into the nose, and that's as difficult as it is. So I get all the time people say, I'm not a doctor, I'm not a nurse, I don't think I could administer this drug. Believe me, anybody can do it because it requires no needles. It's very, very safe. You don't even have to draw anything up. It comes in a pre-filled syringe, so it's wonderful. One of the things that people don't always understand or know is that this drug only lasts about 30 to 90 minutes in the body. So the effects of opioids could last for hours. So when we give this drug, and although people sit up and start talking to you, they could easily go back into an overdose situation depending on the drugs they have on board. So we always say it's very important to call 911 after you've administered this drug, have the person evaluated and make a determination. They can, the EMS, paramedics, whoever arrives can make a determination whether they need to go to an emergency room for further treatment or not. So as I said, this is very easy. So we're going to walk through a demonstration so you can see how very simple this all really is. So little Annie here is going to help me. She's going to be my overdose victim. And when I come upon her, first of all, I don't have to be 100% sure that this is because of an overdose of opioid. If it's not an opioid drug, it's not going to help. This narcotic, this drug is not going to help if the drug that's on board is not an opioid. But if it is an opioid, this little vial right here comes in a box that looks like this. This little container right here, all you do is you just peel it out. You take this out. And first of all, you're going to try to see if you can get the person to wake up and talk to you. You're going to go, Annie, are you okay? Hey, can you hear me? And if I don't hear anything, if the person doesn't respond to me, I'm going to look to see if they're breathing. I'm going to give them a few good rubs with my knuckles right on their chest. And believe me, that's very uncomfortable when someone does that to you. And if they're in there, they're going to wake up and say, what are you doing? But if they don't wake up and say, what are you doing? Then the next thing that we're going to need to do is to react, because we don't have a lot of time to waste. So we're going to get our Narcan out. We're going to tell whoever's around us, please call 911 for me. And then I'm just going to kind of tilt the head back. I'm going to take the little end here and I'm going to insert it into the nose. I'm not going to touch this part right here until I'm ready to put the plunger in, because this only has one dose. There's a single dose in here. If you push this, the medicine is in the air and it's not where it's going to be, where it needs to be. So that needs to go into the nose. So you've got it nice in there in the nose. And then with your thumb, you're just going to press on this plunger. And you're going to press and you're going to leave it for just like count to 3. Just so you know, you don't want to press immediately and pull out because the medicine could squirt out. So put it in, press it, leave it for a few seconds. And then we're just going to wait. We're going to see, and if the person is not breathing and their heart is not beating and you know how to do CPR, this would then be the time to do CPR. So that's basically what happens. And so we're doing, if we know CPR, we're doing CPR. If we don't know CPR, we're just, watching the person, we're waiting for someone to arrive from 911. But after 2 to 3 minutes, if they're not better, we're going to get out our second kit that's in here, and we're going to open that one up, and we're going to go to the other side, to the other side of the nose that we didn't use before, the nair on that side. We're going to do the same thing, put it in. We're going to push the plunger. We're going to wait till it all squirts in. We're going to take it out, and we're going to, again, if we know CPR, if their heart's not beating, if they're not breathing, we're going to continue to do CPR till 911 arrives. If it is, though, an opioid, what's probably going to happen is this person is going to set up and say, what's going on? What are you doing? Who are you? And they're going to just be surprised to hear that they were literally almost dead. So this drug, as I said, has saved thousands of lives. We hope it will save many more. And we're just really thrilled that we have it here. And above it, there is this nice little chart that we made with a QR. I know, QR code. And so you just scan that with your phone, and there's a 50-second video that will demonstrate what I've just showed you here. Thank you.
Thank you very much, Dr. Amler. Next, I'm going to ask Joe Glazer, who's our Deputy Commissioner for the Department of Community Mental Health, to join us at the microphone.
Thank you, County Executive. I just want to share a couple of thoughts, and Dr. Amler, I greatly appreciate that demonstration. It's such an easy thing to do. From our perspective at the Department of Community Mental Health, we understand that addiction is an illness. And to address an illness, we need to be prepared to treat it at virtually any point that arises during the course of that illness. That includes when the illness of opioid addiction is at the point of nearly causing an individual's death. That's what this is about. It's about having one more tool to help treat people who have an illness. From our perspective, and I want to talk a little bit about how we got here just very quickly, for several years, the county has had an entity called ORI, Opioid Response Initiative. It is literally a collaboration of our departments internally, including public safety. It also includes the district attorney's office, the health department, which has broadly led the effort, Department of Social Services, our department, where we come together collaboratively to address opioid response issues the same way we would treat any other disease. A collaborative effort to go into the community and meet the needs of the people who need our help and need access to treatment. Bringing the nalox boxes in here, and I want to thank two entities in particular for getting us to this point. The first is the VOA shelter that welcomed this effort with open arms, and how important it is for it to be here. It means a great deal. The other is our collaboration with County Public Safety. I'm not sure that a lot of people know this, but County Public Safety is the primary law enforcement agency addressing our county-operated shelters. They are our partner in making this happen. And that means a great deal, because when you have the treatment providers, the county executive, who is a strong supporter of this, and all of the governmental departments that are responsible for addressing the needs of this community working together, that means that we are most effectively using our resources to meet the needs of people who need our help. So thank you.
Thank you very much, Joe Glazer, Deputy Commissioner for the Department of Community Mental Health. Next, David Toledo, who's Director of Operations of our Department of Social Services.
Thank you, County Executive Judge Alameda. I think it's a great program, and the Department of Social Service, under the distinguished leadership of Leonard Towns, we support it to its entirety. What's wonderful about this program is that you empower the staff and the responders, to provide assistance or to save a life and stabilize a life in a crisis, especially when someone is under the influence of opium. So I think this is a wonderful program. We support it to its entirety, and thank you.
And let me just again show the appreciation we have for four major county departments that cooperate on these efforts: Department of Social Services, Department of Community Mental Health, the Department of Health, and the Department of Public Safety. There are different elements of the county government, but their joint effort and cooperation has made this possible. So our final speaker is going to be Lijen Thomas, who's the Sector Director for the Volunteers of America. She is our host today, and we're very happy to be here with her and to have these program boxes here inside your facility.
Thank you so much, County Executive. Good afternoon. My name is Lijen Thomas, as the County Executive just mentioned. I work for Volunteers of America, Greater New York. I have worked in the homeless shelter system for many years now, and so it's an honor to speak today alongside with the Westchester County Executive and all Westchester County officials, especially to discuss a life-saving new naloxone initiative that will make our shelters a safer place. As many know, naloxone is a medicine that rapidly reverses an opioid overdose. In our shelters, we have individuals who come from various backgrounds, experiences, and even a lot of trauma. And sometimes society tends to label and categorize these individuals. But we have to understand that in these populations, some or most are struggling with mental health and substance abuse. And as a shelter provider, we assess the clients and connect them to the appropriate services. And even during the pandemic, we saw an increase in clients becoming more symptomatic, their anxieties increasing, and the clients resorting to using more negative coping mechanisms. The shelter staff helped to manage these stressors and helped to redirect the clients from using negative coping mechanisms to using more positive coping strategies. See, our staff work hard to meet the clients where they're at in order to provide services for their needs. And I'm happy that we are progressing towards more mental health awareness, as it should be treated equally as our physical health. And this new program is one example of that progress. It brought me joy that we were able to install the nalox box next to our first aid kit and our defibrillator. We're happy to partner with Westchester County in order to implement this nalox box so that we can hope to give another chance at life for those who are struggling. Thank you again.
Thank you very much, and thank you again to VOA and the people who are here who work with VOA for having us as part of the services they provide to the people in need. Just to pull things together in a final summary, we believe as a society that no life is disposable. Wherever you are at the point in time in your life, whether you are hale and healthy and in the prime of your life, or whether you're dealing with a host of issues, physical, mental health, that your life still has value to it. We would not have sent, as a society, the men and women up the towers on that day on 9/11 if we didn't think the people who were trapped were worthy of trying to save. We do not send people down to try to rescue miners in a mine instead of just sealing up the mine, because those lives are worth saving. And the lives of a person who may be on the verge of dying from an opioid overdose, for whatever the reasons that led them to that moment, if we can save that life, that's what we intend to do. And we hope that this program is one step in that direction. It is not a panacea. It does not end all the issues that we face. There are other issues that come up. But I'm comforted that professionals from Dr. Amlo all the way through the people behind us are using their knowledge of medical science, using their knowledge of how best to deal with people in stressful situations, to try to help save their lives. And we hope that out of the process of saving their lives, we preserve their lives long enough that they can then find better lives, and they can be more productive members of the society and get the respect that every single person deserves. Every single person deserves the respect and the opportunity, and we hope that this program is one more step in that direction. I don't know if we have anybody here from the press that would like to ask a question. If we do, and the question is beyond the simplest amounts, and I'm probably not able to handle them, but I would invite you to call, if you're picking up the feed, any of the press picking up the feed, call us at our communications department, 995-2900. Ask for the communications department. Carolyn Fortino is on duty with us today, Joe Scamato, John Borston. They'll be happy to connect you with any of our speakers. They'll be happy to connect you to Ms. Thomas, to anybody else you'd like to ask questions to. But absent that, we thank you for tuning in, and we'll be communicating again, as we regularly do, with what we hope is helpful information and hopeful information about how we're trying our best here in Westchester County. I'm George Latimer, the County Executive. Thanks for watching. Have a good day.